What do you say, for example? What is the benefit of neurophysiology? No problem. Anybody wants to laugh? Thank you so much. And the most important part of neurophysiology is like how you can connect between neurophysiology to neurological diseases, nervous system diseases, because the name is clear, neurophysiology, how nervous system works. What is neurophysiology? The normal functioning of nervous system. Let me give you some, and it is important that finally you should understand how you can deal with nervous system diseases or neurological diseases, because the most important part of occupational therapy is for the patients with nervous system diseases. And so first you should know that what is nervous system, what is the function and the tasks of nervous system, and how nervous system do its tasks. We call it neurophysiology. Who knows the definition of physiology? Did you have physiology classes also? What is physiology? Who knows? What is physiology? The science of what? What is structure is neuroanatomy, is anatomy. The structure of nervous system is anatomy. So what is neurophysiology? Brain what? Function. See, neurophysiology are, first of all, you should know some alphabets of medicine. You are a doctor, you know. You are a doctor, you are from treatment. And you should know what you should do for your patients. And today I want to talk about this and what you should do for the patients and what is your goal and how you can do these goals. Okay, you know what you should do for your patients, but you should also know how you should do that. Which strategies you should use. Exactly. What is necessary to do for your patient? So, first, I will give you some very important alphabet that first you should know, and then you will understand why you should study neurophysiology. First, today we should just discuss together, just talk. I don't give you any special content, and it is very important. What is the goal of treatment? Whenever you want to treat any patient, what is the meaning of treatment? Who knows? What is the meaning of treatment?
To reduce the symptoms.
Very good. What else? Remember, this is very important. I think today I want to give you the most important topic in all your courses, even if you go to PhD and post-PhD. Because you should know first of all what you want to do for your patient. It's just for reducing the physical symptoms. This is your job.
Improve quality of life.
Very good. This is important. Improvement of quality of life. This is a review. What is quality of life? Because you should know, okay, your job is improvement of quality of life. So how we can improve? What do we mean improvement of quality of life?
Independent self.
Very good. So, first, quality of life first is important in the performance and the health. This is what you should do. Improvement of health, improvement of performance. Improvement of performance, one of them is independency in daily living activity. Independence.
IADL.
What else?
IADL.
Daily living activity. Means toileting, bathing, walking. This is independence, eating. For example, I sent some patients to you that cannot eat independently, needs the others, cannot go to toilet alone. He needs some help, he needs some assistance, and you'll help them that they can do their daily living activity independently.
And instrument daily activity.
New skills.
No, for improvement, performance, new skills in what?
Social participation.
Very good, social. This is personal activity, this is social activity, which means what? Social activity, what do we mean?
Communication.
Communication. So improvement in communication skills.
Work.
What else?
Professional.
Education.
Professional is about the job, professional activity.
Education.
And your name is originated mostly from that. What is not completely expressive of your job. Occupational therapy, علاج وظيفي means how you can help with their job, but it's not complete. In my opinion, the name of occupational therapy is not complete for you. Because you mostly work on performance, all performance, not just job. I mean that the person who named the occupational therapy from occupation means performance. So even in daily living activity, it is important that you help the patients how to do their activities, which we can call it job, in personal life, eating, toileting, bathing, cleaning, and which other, but when we say occupational therapy, see, you are an important wing of treatment. Because occupational therapy means improvement of performance. Very important. Most of the patients who are referred to me needs occupational therapy. Most of them. So whenever I want to have a private office in my field, I should have an occupational therapist beside myself. And I have. Because when we talk about quality, increasing the quality of life, increasing the performance is one of the main important goals, targets. And here occupational therapy means performance therapy. It's better to say performance therapy. And the third, what? Education, very important. Educational activity, or school activity, or academic activity. So your job mostly is improvement, the quality of performance in any of these domains which are disturbed. Daily living activity, it's better to say independent daily living activity. Communication, improvement of communication. Speech therapists mostly enter here. You can use or have teamwork with a speech therapist. But anyway, you are on the top. Because again, communication is a part of performance. You can also have idea about improvement of communication of your patients. Education. What is education? Mostly the definition of education is what?
Receiving and processing.
Yes. What?
Information.
Information.
No. What
Learning.
you do here?
Learning.
Learning. Education here means learning. And learning is a part of cognition.
Attention.
So one of, and in my opinion, the most important part of your job mostly is learning. Learning is a type of cognition, is a domain of cognition, a part of nervous system function. And job.
Employee. Work.
Exactly. Working, occupation, job, profession. So, but about health, just I mentioned that health means in mental health, and this is important for you. Without, because in the past classes I talked about, without mental health, never you can reach to improvement of performance. Any person in the field of medical sciences should be a good psychologist, without any exception. Because if you are not in good mental health status, never you cannot improve the performance. That's why in the classes in the past year, we had classes about psychology. You remember, yes? Why you should learn psychology? Because as I mentioned, mental health is completely necessary for performance. This is continuous learning. Okay, you learned what is mental health. And first of all, for any patient, you should consider mental health, which leads to improvement of performance with extra strategies. So, a professional occupational therapist should be a professional psychologist, because without mental health, never you can reach to the goal of improvement of performance. What else? Physical or somatic health, which, as you mentioned, decreasing the symptoms, decreasing the pain. And this is important, you should consider as a comprehensive medical management, which is social and family support. It is very important. It's a part of health. So, any patient in any field of medical sciences, this is what the team of treatment should do for the patient. Improvement of quality of life. What is quality of life? First, performance. Your field is complete. You are the head of this wing. You are the head of this wing. This is a crown. Imagine that. This is a crown. The head of performance, improvement of performance, are occupational therapists. Very important job. Very important. And about health, improvement of health, physical health, mental health, and social and family support. Don't think that this part is for example, for medical doctors. No, you should also have some ideas about mental health. You should have some ideas about physical health and social and family support. Some patient doesn't have any social and family support. You cannot say that, okay, it's not related to me. You should talk to the family, you should talk to the parents, son, daughter. For example, you have patient with dementia, Alzheimer's disease, and the patient doesn't have good family support. You should talk with the family that you should support your patient, and you will see that with this recommendation, the quality of life of the patient increase. Never think that everything in this field is just medications, just drugs. No, with some recommendation, even with talking with positive energy with the patient, leads to upgrading the mental health of the patient and improvement of the performance. You are a doctor, you are not just a robot. You are not artificial intelligence. You should comprehensively care the patient, although your main focus is improvement of performance. But without paying attention in this part, you can never reach to this target. So sometimes maybe you need some consultation with some medical doctors, but you should have an idea in treatment, in diagnosis, in management, also of mental health, physical health, and social and family support. Believe me, just one patient, completely depressed. I just recommend to the family, you should have more support for your patient. For the next week, the situation of the family was better, the situation of the patient was better. Just paying attention that what is your job, what is your task. You should not think, analyze, okay, this is just for a speech therapist, it's not related to me. This is just for psychiatrists, not related to me. This is for the medical doctors, not related. This is for the family and governmental issues, cultural issues, it's not related to me. No, in this way, you can never reach to your goal, improvement of quality of life. Maybe you do something for the patient, but it doesn't lead to improvement of quality of life. As I mentioned, a lot of occupational therapy for autistic patient, and you ask the patient, you ask the family, do you feel better situation from these treatments? Nothing. It means that did your quality of life improve? Say no. But the occupational therapist, right? At least I did that, I did that, I did that. Now these skills is better. But when these skills doesn't lead to better quality of life and better performance, it means nothing. And if you don't have comprehensive vision of the patient, please, during your fields, you should practice more. That you should have very comprehensive vision of the patient. Never tunnelize your vision. You are a doctor, you should ask about the mental health status, physical health status, social and family status, and how is the situation of the performance, and then you say, okay, this is the problem list of my patient. In these fields, he has problem, and for all of these, you should have some strategies. Although these strategies may be referring the patient to another doctor, no problem. But you are caring the patient. You have idea about that. Sometimes it's better, okay, the patient is depressed. The first strategy, talking with the patient. Okay, the patient is hopeless. You can give hope. I will help you, don't worry. We can do a lot of things. I will help you. This is what a doctor can do. This is the first important thing that everybody should pay attention. But now we want to touch. Mostly in medical sciences, any problem in any part of these parts, we use a word disease. Use a word, we call it disease. What is disease? Who knows the definition of disease? Again, as a review. Any harmful deviation from normal function, from normal activity. We call it disease. What is disorder?
Abnormal function.
It means that abnormal function in what?
Performance.
Anytime, any deviation from normal function. So this is a word of physiological function. I want to reach to the word physiology. Disorder means any disease affects on performance, affects on your daily living activity, academic activity, communication, profession activity, job. This is disorder. What is your tasks? Improvement of performance. So disorders are referred to you. Disorders mean any problem in daily living activity, academic activity, communication and job. So what is disease? Disease is a word of physiology and leads to abnormality of health. Health is the antonym of disease. And disorder is the antonym of normal performance. See, these are very important alphabets that everybody should understand, should know. As I mentioned, you are a medical doctor. So, disease is the antonym of health, and disorder is antonym of normal performance, normal function. And does all the diseases lead to disorder?
No.
No. Sometimes you have a common cold, but it doesn't affect on your daily living activity, communication, job, and you can say communication. You have, for example, headache, but you have normal function. But headache can lead to disorder. For example, you have a very severe headache and you cannot go to your job. It means that now you are facing some types of disorder. So, this word very important. Disease, a physiological word, an antonym of health. So you should know what is health. What is mental health? What is physical health? Although social and family problems is not a physiological word, but disease mostly used for these two parts. Any abnormal functioning of mentality and somatic function. So, for definition of disease, I told you that I gave you definition of homeostasis. Homeostasis is normal physiological function. But for homeostasis, we have different levels. Again, I want to reach to what is neurophysiology. That for this part, okay, we talked about disorder. Now we want to talk about what is disease. So, step by step. Till here, any question? Just yes. I don't claim it. You can after that you can take it. Okay. When we talk about homeostasis, we define homeostasis in different levels. I mean that at the level of the body as a whole. Homeostasis of the body depends on the homeostasis of body. Yes, homeostasis means balancing function or normal function as a whole. We call body as an organism. So, normal functioning of the body depends on normal functioning of what? In your body, your normal functioning depends on
Function of nervous system.
just nervous system. What else?
What organs? Mental health.
Mental health is normal functioning of nervous system.
Whole
So,
system
normal
together.
functioning of whole body depends on normal functioning of
Immunity.
Systems.
systems as a whole, not just nervous system. For example, gastrointestinal system, normal functioning of the body needs food. Gastrointestinal system prepare food. This food should be digested and attracted, and these material, these nutrients should be sent to the cells through what?
Absorption of nutrients.
Cardiovascular system. Also, you need oxygen for normal functioning of the body. Respiratory system prepare oxygen. Cardiovascular system send oxygen and nutrients, supply oxygen and nutrients to the cells. And also nervous system. And we will talk about nervous system in special. Normal functioning of system depends on normal functioning of its
Organs.
organs. Normal functioning of organs depends on normal functioning of
Tissues.
tissues at first, and then
Cells.
cells. This is what we call health or homeostasis. So, normal functioning of cells leads to normal functioning of tissues. Normal functioning of tissues leads to normal functioning of organ, and normal functioning of organ leads to normal functioning of systems, and normal functioning of system leads to normal functioning of the body. And whenever we talk about health, we mean both mental health and physical health. So normal functioning means complete health, comprehensive health, full health of the body depends on full health of the cells in all over the body. So now we want to talk about nervous system specifically, because we talked what is the function of gastrointestinal system, what is the function of respiratory system for keeping the homeostasis of the body, what is the function of respiratory system for keeping the homeostasis of the body. So, nervous system also as a system has some role in keeping homeostasis of the body. What is neurophysiology? Neurophysiology talks about that. What are the functions of nervous system to keeping the homeostasis of the body, and how nervous system do it? For sure, we should talk about normal physiological function of nervous system. You have which organs, and you have what each tissue, and you should have what cells. How nervous system do these jobs for keeping the homeostasis of the body? This is physiology. Neurophysiology means physiology of nervous system. What is physiology of nervous system? Means what are the tasks of nervous system for keeping the homeostasis of the body, and how different organs do its task to do the normal functioning of nervous system. Let's say that what nervous system do for homeostasis of the body and how nervous system keep the homeostasis of itself. It means that what are the roles of the organs, tissues, and cells in nervous system to keep the homeostasis of nervous system, and nervous system keeps the homeostasis of the body. This is what you should learn, that what is neurophysiology. So neurophysiology, we talk about what are the functions of nervous system and how nervous system do these functions for keeping the homeostasis of the body. Okay, what are the functions of nervous system for keeping the homeostasis of the body? Who knows? The functions of nervous system. This is neurophysiology at first step. What are, for example, for gastrointestinal system, preparing the appropriate nutrients for the cells, for metabolism of the cells. This is the function of gastrointestinal system. What is the function of respiratory system? Preparing oxygen for normal metabolism of the body. Now, my question, what are the functions of nervous system to keeping the homeostasis of the body?
Motors, the body about move the upper
Who can structurally talk?
Paralysis?
First of all, keep the patients conscious and aware about the environment.
Attention.
For what? This is the functions for keeping the homeostasis of the body. I will talk about all the functions in detail. Second, so keeping the person conscious and aware about environment. First of all, let me tell you something, that when we talk about environment, we have two types of environment. Internal environment and external environment. When you say that awareness about himself, it's important. Awareness about outside is important. So, the first function of nervous system is keeping you conscious and aware about the environment. For what? Okay, you are conscious and aware. For what?
To receive the information.
Very good. Collect informations from internal environment and external environment. For what?
For processing.
For processing of this information. For what?
For to make decisions. Or
This is processing, decision, and for appropriate. Okay, you collect information, process, and appropriate
reaction.
response, reaction, which is true motor system. So, when we say that, what is the main function of respiratory system? Respiratory system is responsible for preparing oxygen for the body. This is the main function.
Yeah.
If anybody asking what is the main function of nervous system, is what? Appropriate response to environment, to protect the body. But this appropriate response first needs consciousness and awareness, collection the information, processing the information, and appropriate response to motor system. But in addition to this main function, we have another main function of nervous system. Okay, in addition to appropriate response to stimuli of the environment, we have another main function. What is that? Sense, we call it. Sense means collection of information, processing of information for appropriate response, and the other which is very important, and everybody should know. But this function mostly even is forgotten with neurologists. Neurologists and psychiatrists must pay attention to this part. Okay, the main function of nervous system is appropriate response to environment, but it has another important regulation. What does it mean? It's very important that in addition to main function, which is appropriate response to the stimuli of the environment, is regulation of the other systems. It means that the homeostasis of other systems depends on nervous system. It's very important. So whenever you consider you face some nervous system disorder, it's not just a localized problem, it's a systematic problem. When you have problem in nervous system, you will have problem in cardiovascular system. You will have problem in gastrointestinal system. Because the homeostasis of all other systems depends on normal functioning of nervous system. This is a special task of nervous system. The other system which has such this task is endocrine system. So we call it regulatory function. So in addition to appropriate response to the environment, the nervous system has another function, we call it regulatory function. So regulatory function is some function of nervous system which prepare the homeostasis of other systems. Normal functioning of respiratory system depends on normal functioning of nervous system. Normal functioning of gastrointestinal system. Normal functioning of kidneys. Normal functioning of cardiovascular system. In the last semester, I asked you what is the main reason of death in Alzheimer's disease? How Alzheimer's disease patients die? Why? What is the reason of death in Alzheimer's disease?
Did not remember short.
So they died? Oh, I don't remember you. You died? Do you remember this? No. Like movies.
Maybe suicide.
Alzheimer's diseases, did you see any suicide to them? They don't have even energy to kill themselves. What? Taban?
No, dopamine.
Dopamine exists, leads to death. Do you enjoy from this? No.
About the system.
Okay, what is the main reason of death?
هذا
For example, you have a patient with Alzheimer's disease. If anybody asks you how this patient will die,
There's some problem in the brain.
about regulation,
but
regulation.
regulation, okay, this is about regulation.
It's some way, some area, some area.
Anybody asks you why my father died because of Alzheimer's? Because of regulation. What is the main reason of death? For example, the main reason of death in young, for example, society is, for example, car accident. Completely everybody understand. The main reason of death in Alzheimer's disease is regulation. What is regulation? Please explain.
Reflection of the system.
What?
Regulation. Not have balance and regulation of perfection.
Okay, so what is the main reason of death in Alzheimer's disease?
From the cell up to the
Weakness of
Nervous system suddenly is off. For example, you, hello father, hello. Oh, my brain is offing.
Maybe he forgets.
For example, this is like a kid. the last cell. Okay, what happened in the brain? See, the main reason of, for example, death in the past decade was corona. It's completely clear. If I don't have any academic,
Yeah.
you know,
Failure in general function,
very good. Which function?
like neurological.
So what's it? For example, neurological function leads to death. For example, I cannot go to toilet alone. You will die.
lose cognition.
Lose cognition, for example, like forgetfulness. Exactly the same. Oh, my son, I cannot remember you. Will die. I'm sure that in the past semester, again the same discussion happened and you forgot. You reach to the point, okay, the main function, because of losing the regulatory function of nervous system, leads to what, for example? You say cell function is okay, but what is the main reason of death in Alzheimer's disease?
Leads to decrease the effective of the system. For example, the cardiovascular system.
Very good. Cardiovascular attacks. They will have myocardial infarction, they will have myocardial insufficiency, arrhythmia. Yes, this leads to death. Oh. This is the reason of death. Not, okay, I cannot go to toilet. No. But, I have chest pain. This is the main reason of death in Alzheimer's disease. And you say that, okay, Alzheimer's disease is a neurological disease, not cardiovascular system disease. Yes, any problem in nervous system leads to losing normal functioning of other systems. But the main reason of death in Alzheimer's disease is not the first rank cardiovascular attacks. The first rank is infectious diseases. So what is infectious disease? Because of defect in immune system. Yes, because regulation of immune system is done by nervous system. The patient has defect in immune system. And infection leads to death. Pulmonary infection, sepsis. Yes, I have severe fever and this leads to death. Infection and cardiovascular attacks. So, infection, immune system, cardiovascular attacks, cardiovascular system. The patient, you said Alzheimer's disease. Yes, Alzheimer's disease is systematic disease. Why? Because the normal functioning of other systems depends on nervous system.
Alzheimer may be genetic or active?
Alzheimer?
Yes.
Could be genetic, but must be considered as acquired disease.
So,
But these are some let's say, you can say that different types of etiologies has role. For example, for sure, when you have any in your family history, any patient with Alzheimer's disease, you should be more cautious. But Alzheimer's is considered as an acquired disease. Okay, all my family didn't have any history of Alzheimer's. I am came prone to Alzheimer's. It doesn't mean that when you don't have any family history. And also, when you have all your family faces to Alzheimer's. No, it doesn't mean that for sure you will get Alzheimer's. Okay? These are some, we call it epigenetic. Epigenetic effects of environment and a lot of issues and domains and topics together and leads to some neurodegenerative issues. So, neurophysiology is what are the main functions of nervous system for keeping the homeostasis of the brain, appropriate response to stimuli and regulation of other systems. And this is the first part of neurophysiology. So half of the neurophysiology you learned. And how nervous system do these jobs for keeping the homeostasis of the body. So the second half we should talk. How nervous system keep the homeostasis of the body. I mean that how prepare consciousness and awareness. How do sensation, how do processing information, how do motor response, how do regulation. This is what we call it neurophysiology. And any deviation from normal functioning in each domain leads to neurological diseases. Consciousness problem, loss of consciousness. Awareness problem, loss of awareness. Problem in sensation, sensory loss. Problem in cognition leads to different types like dementia, cognitive impairment, cognitive disorders, motor disorders, and regulatory disorders. These are when any deviation in normal functioning in each of these domains leads to neurological disease. So this is an introduction, and now we should talk about what and how different domains are done in nervous system, which leads to homeostasis of the body. 5 minutes rest just in your place. And I have very good news. Your class is very, lovely for me, because in the class of medical students last week, I had class, and I really couldn't sleep, and my boss was really harsh, and somebody went out in front of me, and I thought, okay, and finally some person understood that I need some water. And after 5 minutes, come back without anything. Oh wow! But honestly, I didn't tell them anything, but now thank you very much. It's really priceless for me. It means that you can put nothing as an expense for them. Thank you. Thank you. So, you know the meaning of physics, but this is what I want you to pay attention to. That finally, any course you have in this major, you should reach to this point that what you should do for your patient. We call it a diagnostic process. It is very important that, as I mentioned a lot of time from the past year, that whenever a patient is referred to you, the first step for you is taking history and physical examination for all patients. Never start treatment without taking history, without physical examination. Why? Because during physical examination and taking history, you should make a professional relationship with the patient. This is very important. Without professional relationship with the patient, you can do nothing for the patient. Believe me, never ever. Okay, even you don't talk with the patient, you do some jokes. Even with the kids, even with the baby, so that the baby doesn't understand anything. No. Remember, for upgrading the quality of life of the patient, you should have a professional relationship with the patient, without any exception. Yes, for sometimes you think that because of some, for example, personality problems, personality disorders, you cannot make a professional relationship with the patient. Never even enter the treatment of the patient, because you can do nothing and you will have a lot of problems. You will face a lot of problems with the patient. So as a rule, remember, whenever you think or you see that you cannot make professional relationship with the patients, never start it, because at the end you can reach nothing and you will face a lot of problems. So the first step of any patients come to you, even with a referral letter, that okay, please doctor, do this for the patient. First, you should make a professional relationship with the patient. First, you should start taking history and neurological and physical examination. But what is the aim? What you should reach? First, clinical diagnosis. Problems. Problems means what? Problems in what? What is problem listing? Not just the symptoms and the pains. Problem list is what?
Problems in function.
Problem list means any problem in any of these domains. Mental problem, physical problem, social and family problem, and problem in daily living activity, performance, communication, education, job. This is problems. Not just some physical problem. This is very important. You are a doctor, you should have a comprehensive vision. This is the most important lesson that anybody can tell you in a class. Believe me. This is what distinguishes you between you and other ordinary occupational therapists. That you should have a comprehensive vision. That what is the problem list of the patient and what you should solve for the patient. Any problem in any part, mental problems. If you forget that the patient has mental problems, for sure you can do nothing for improvement of their problems. You should ask about the mood of the patient. You should ask about the feeling of the patient. You should ask about the cognition of the patient. Do you think that I can help you? I say no. It means that you can do nothing. So if the patient says no, I cannot trust you, first you should try to attract the trust of the patient. Negative thinking, no hope. You should make hope for the patient. You should convert negative thinking to positive thinking. This is the first step. With negative thinking, again, you can do nothing. Everybody says that occupational therapy is just a business. They do nothing for the patient. Yes, if you don't know that, for preparing any improvement in this field, you need mental health. For sure you can do nothing, but if you know, you can do everything. Some patients are end-stage cancers, and they have lost a lot of domains in health and performance. And take to a doctor and say, no, I can do nothing for him. Don't bring him anymore to me. It means that he has not understood that what is treatment. For sure, you know that the patient will die after 2 months. You can do a lot of things for him. Treatment doesn't mean cure. It means improvement of quality of life. This is the art of a doctor. You know that in a place that I was working in a city, every patient died, they put some appreciation letter in front of the city. Wow, he died, they are appreciating you. He has a relative that for 2 months he will be dying. Everybody is anxious, everybody is depressed, everybody is, doesn't know what we should do for him. But you prepare that, don't worry. This is what we will do for the patient. And during this period of time, we should consider that how we can prepare a good quality of life for the patient. And you manage the situation. The family is disrupting, but you manage and control the situation. Don't worry, this is what we can do for your patient. And you will see that the patient is in good mood, the patient is hopeful, till the time he died. And after that, they said, thank you very much, doctor. We managed our family. Our family was disrupting. You cannot imagine that some autistic patients destroy the family full. And you say that, okay, autism doesn't have any treatment. No, treatment doesn't mean cure. Yes, maybe you cannot cure the patient, but you can prevent from disruption of the family. I have a lot of patients, the ADHD patient destroys the family completely. The daughter escaped from the family, the son escaped, the mother attempted suicide, and the father completely depressed that cannot control the situation. And a person who we call it Tabib, Hakim, come and manage the situation, know what we should do. Okay, what is this problem for autistic patient? Is problem in the domain of communication, because the patient cannot communicate with his brothers and sisters. All of them try to escape, cannot communicate with the mother, escape. And you work on a lot of some skills and say, I have the what? You see that no change at the level of the family. But what time you can say that I have done something for the patient? Okay, I have improved the communication of the patient. Now the daughter is at home. Now the son at home. Now the mother is better. Now the father is more hopeful. I think that, okay, I can manage the situation. And you are a person who are helping and preventing from the disruption and destruction of the family. So, this is the job of an occupational therapist. Improvement of communication. The person doesn't have any job and a lot of economic problems, and you are helping the patient to return back to some job. You are helping economic situation of the patient. But most of us just spend the money of the family, decreasing the money of the family. No, you can help the family better quality of life. So, the first step of taking history of physical examination, the first achievement is problem list. Problem is not is just physical problems, mental problems, family problems, any problem at the level of performance. If, for example, your patient has some defect in some domains of performance, and you don't ask, and you don't know what is the basic situation, how you can monitor your treatment response? So, okay, the patient has, did you ask about his daily living activity? Did you ask about communication problems? Did you ask about education problems? About participation? How is the school activities? Did you ask about the job of the patient? No. So how you can monitor your treatment response? After 10 sessions, just you write, these are what I do for the patient. What was the benefit of your job for the patient? And if you cannot monitor, how you can control the situation? But when you monitor the patient, you see that, okay, I am trying to improve the performance of communication, but no improvement happened. You should go back again and see what was the problem. Okay, maybe you didn't consider some mental problem. Maybe you didn't consider some performance problem. Then again, you should plan another strategy for treatment. You should be completely solid, aware about the situation, the process, the promotion, the progression of the patient. Monitoring of the patient. How you can monitor the patient? At first session, you should be completely aware what is the health status, what is the performance status of the patient. And any deviation from normal health status and normal performance status, you should list and then predict, plan what you want to do with these problems, what you want to do. And during your treatment, you should monitor which are being better, which are being worse. This is a doctor should do. Otherwise, you can do nothing. Okay, you learned about a lot of the strategies in occupation. You are a very scientist, you are a very good researcher, but you don't know these things, that how you should manage the patient. In my opinion, medical sciences are easy, but if you don't know these rules, you can do nothing for the patient. Otherwise, you have a lot of knowledge. Nowadays, artificial intelligence has a lot of knowledge. But the difference between a doctor and artificial intelligence is that never ever medical doctors could not be replaced by artificial intelligence. Never. In engineering, yes, but medical doctor, no. But you should have very structured approach for the patient. You should know what you should do for the patient, step by step. So, this is very important for you, that problem list doesn't mean there's just some physical problems, any mental problem, any social problem, any abnormalities in the performance, which we call it disorder. And then you should be able to localize each system and which part of each system is involved. Okay, any neurological problems, including consciousness loss, awareness loss, sensory loss, cognitive impairment, motor disorders, and regulatory disorders depends on nervous system and which part of nervous system. For example, regulatory system is involved, okay, sympathetic and parasympathetic nervous system is involved. consciousness is involved. Okay, ascending reticular activation system or bilateral cerebral cortices are important. We will review it during neurophysiology. The patient has sensory loss. Okay, sensory system is important. The patient has problem in cognition. Okay, cognitive system is important. So you should be able to localize which system and which part of nervous system is important. And then go through etiology diagnosis. What is the etiology? And in the end of this lecture, during 2 to 3 sessions, we will talk about, okay, which etiologies can disturb normal functioning or normal physiological functioning. This is important. So, this is what you should do for your patients. A problem is, but what is problems? Consider mental problems, physical problems, social problems, the problem in activity performance, communication, job, and academic activity. Then localization, and then etiological diagnosis. So this is what we should consider. Any psychological problem, any physical problem, any family problem, and any problem in performance. What do we call it? Disabilities, disorder. This is very important slide. Very important slide. So, this is another review of the main function of the nervous system. This is the last slide. Just review. The main function of the nervous system is appropriate response to stimuli. We will talk about what is, and regulation of other systems. For appropriate response to a stimuli, you need maintenance of consciousness, which next session I will talk about consciousness and purpose. Collection of information, processing of the information, and appropriate response through motor system, and regulatory function, which means balancing the chemical and physical parameters of other systems, of other organs, of other tissues, of other cells. And it is very important that if you lose normal functioning of the nervous system, based on this function, you lose other systems function also. So this is just an introduction to neurophysiology. And from the next sessions, we will talk about different domains of nervous system function. I won't give you a very huge content, and your examination, I'm sure that is easy. But I will give you very important topics, which helps you in your future performance. So any question? Thank you very much. Now I am drunk.